A very good evening to you. Thank you so much for joining us for yet another interesting edition of Family Health. And our focus this particular evening is just on the ear. But first, let's find out what to expect on the show.
Patients who have been on treatment for TB, their hearing goes down.
This is not very easy to tell, but I'm exploring the middle ear, cleaning from unwanted tissue and repairing the ossicular chain.
Once again, thank you so much for joining us. My name is George Oraro. Getting right into it, we need our ears for hearing. But have we ever stopped to think about some of the issues that affect the ear? Well, from watching this, you'll know the essence of going for screening every now and then.
An organ not only responsible for hearing but balance, the ears, just like the different body organs, attract a myriad of conditions that affect it. These conditions cut across different age groups, and when it comes to kids, they are usually associated first with delayed speech.
The commonest is water in the middle ear. We call it OME, otitis media with effusion. When there is fluid in the middle ear, the children have difficulties in hearing and they get delayed speech. Some of the other causes of delayed speech in children is a sensory. It's normally the sensory neural effect. That is when the nerve of hearing is affected. Meningitis is also a very common cause of hearing loss in children. Birth trauma can also cause hearing loss in children.
Luckily for children, getting help at the right time is essential to avert further damage.
It is very important to discover early that a child is not able to hear, because we can intervene very early by giving these children hearing aids. But the problem in our setup is that most of the parents really don't seek medical help early. They come very late in life.
As for adults,
I think the commonest defect in old age is a condition called presbycusis. Because of the changes in the body, the hearing of a grown-up actually goes down. And some of them you cannot treat them because you only intervene by giving them a hearing aid. Even in adults, you can also get ototoxicity. Like for example, patients who have been on treatment for TB, their hearing goes down. And some of those patients, if it is very bad, you have to give them hearing aids. The other commonest problem we have seen in this clinic, patients have come and they tell us they've been treated with an injection of quinine. Some of their hearing loss also goes down. I think HIV is also a contributing factor to some patients. Their hearing goes down. And some of the causes can also be viral.
Wax can also be an impediment when it comes to hearing loss. This buildup is a common reason for a hearing loss.
When wax is in your canal and it is obstructing your eardrum, you are not able to hear. But that one, we easily intervene because we just clean off the wax and you begin hearing.
A key sign to hearing loss would be a decrease in the ability to hear well.
In fact, one of the signs of somebody who is deaf, they always speak very loudly. And maybe if you are in the house with them, they will increase the volume of the TV or the radio. Or they will tell you, I see people laughing and I don't know what they are talking about. And they usually feel very frustrated. In fact, the first thing you see in them, when you give them a hearing aid, the first thing you see in them is a smile, especially the grown-ups, because they just realize they've been missing a lot.
Other signs include muffling of speech and other sounds, difficulty in understanding words, especially against background noise or in a crowd of people, trouble hearing consonants, frequently asking others to speak more slowly, clearly and loudly, turning up the volume of the television or radio, and withdrawal from conversations. Aging comes with degeneration of delicate inner ear structures over time, being one of the factors leading to hear loss. Apart from this, there exists other risk factors that may make one more susceptible.
Of course, noise pollution is the commonest. Noise pollution, like in our city, by the way, there is a lot of noise. You get it in the matatus, you get it in the streets. So that is the commonest. Of course, drugs, if they are not properly prescribed by the right people, drugs is one of the commonest environmental factors. We have also seen people who have been abused. Trauma, like if you slap somebody very hard, you can perforate their eardrums. And if there is no intervention to repair the eardrum, you have exposed that person to infection, because their ears will be prone to getting infections. Anytime you get a cold, bacteria can travel from your throat to your middle ear and out. And we have so many children with ear infections.
Hearing loss is categorized into either being temporary or permanent. If it is a result of wax building up in the ear canal, this can easily be reversed.
If I find the patient has got wax in his ears, I can use a microscope and a sucker and this tube and tip and suck out the wax. That is one method. And this is the safest method, especially for those ones who have perforated eardrums. Because if you use an ear syringe, before one is syringed, it is very important for whoever is cleaning the ear to look at the eardrum. Because if the eardrum has a hole as a result of the infection, you can easily dislocate the bones in the middle ear, which are responsible for conducting sounds to the inner ear, which is in the brain. And once you dislocate the ossicular chain, the patient will never hear again.
When it comes to diagnosis, history of the patient will first be taken, followed by a series of either physical examination or thorough audiometer tests.
You must get the history from the patient. It's very important, because through history you can know if this patient has other relatives who are deaf, for example, in the family. Deafness can also be genetic. So history is very important. You can know if the patient you are dealing with has taken certain drugs, like drugs for TB. A patient will tell you, I have TB. Another one will tell you, I'm HIV positive, I'm in immunosuppressive drugs, ARV. So history is very important.
Treatment depends on the cause and severity of the hearing loss.
The treatment varies. There are those ones you give local antibiotics. There are those ones you prescribe hearing aids. And there are those ones who need surgical intervention, like if they have perforated eardrums, the best way is to repair that eardrum, because you'll cut off the recurrence of infections. If the hearing loss is because of drugs which are toxic to the ear, those ones you cannot intervene. But unless you go to advanced countries where they have started doing cochlear implants. We have not started cochlear implants, Daktari, here, but I think we are getting to that. If you think your child has delayed in developing speech, if you think your child does not hear, the best thing to do is to go to an ENT clinic whereby you can be assessed, because if you wait for too long, for example in children, language is supposed to form completely after 3 years. If you wait for too long, like I have seen parents coming after 7 years, something else will occupy the speech center in your brain, and that child might never develop speech. If you have had speech and all of a sudden you are not able to, if you are hearing before and all of a sudden your hearing changes, that is a good reason to rush to a health facility.
A very informative piece right there. At least we now know. Don't assume your ears are okay, so there's no point of going for a screening. At least make it a habit of going every once in a while. I should be going for a short break, but just before that, let's look at some of the interesting facts about the ears. That bit on sleeping, very interesting. Let's take a short break, but we'll be right back. Stay tuned. Once again, thank you so much for staying tuned to Family Health. In a short while, we get into the theater, but just before that, they always say that an apple a day keeps the doctor away. Let's find out how true this is up next on Eat Smart.
Considered to be the healthiest fruit one can eat, apples have tremendous benefit to the body. One of them is to lower cholesterol levels. One medium-sized apple contains about 4 grams of fiber. Some of it is in the form of pectin. It blocks absorption of cholesterol, helping the body to use it rather than store it. We all want that $1 million smile with a set of white teeth. Get whiter, healthier teeth by biting and chewing an apple. This stimulates the production of saliva in the mouth, reducing tooth decay by lowering the levels of bacteria. Don't get it twisted, as this doesn't replace your toothbrush. A new study shows that drinking apple juice could keep Alzheimer's away and fight the effects of aging on the brain. Apples also decrease the risk of diabetes. Women who eat at least one apple a day are 28% less likely to develop type 2 diabetes than those who don't eat apples. Apples are loaded with soluble fiber, the key to blunting blood sugar swings. Whether you can't go to the bathroom or you just can't stop, beat that diarrhea and constipation by going for this fruit. Fibers found in apples can help pull water out of the colon to keep things moving and rolling, or absorb excess water from your stool to slow your bowels down. Forget about supplements when it comes to boosting your immunity. Red apples contain an oxidant called quercetin. Quercetin can help boost and fortify your immune system, especially when you're stressed out.
From that, now I know you appreciate why you should be taking apples every other time. Earlier on, when we were starting the show, we brought to you some of the conditions and diseases that affect the ears. Well, we were fortunate enough to record one of these corrective procedures that meant to restore hearing. Do have a look.
Frail, with the effects of anesthesia wearing off after a surgery that took 1.5 hours, but thankful for successful surgery. Eunice woes started in 2010 when she had trouble hearing.
Nilikuwa nasikia masikio imefugana. Nasikia kama ni shafo, kama sisikii mzuri, kama kuna sauti inatoka. Ile sauti tu nasikia kama kuna kitu, kuna makelele.
Eunice had to undergo a corrective surgery to get back her hearing. Inside the theater, the procedure started by getting anesthetized.
So when the patient is brought in, we usually induce them into anesthesia by using drugs, and thereafter we have drugs and the machines that maintain the anesthesia for as long as the patient is under the operation. This basically, the machine that is behind me is the one that it's the anesthetic machine. So as you can see, we have these gadgets that we are using, and they provide the gases.
So she's intubated with a pipe down in the throat, spontaneously breathing, which we can see here. She got 30 breaths per minute right now. We can also see here that she's nicely breathing. The monitoring in itself is here: blood pressure, pulse rate, and saturation rate, which means that we monitor the oxygenation at her fingertip. If this is good, the whole setup is good. And she's asleep on a mixture of oxygen and nitrous oxide, combined with some volatile agent called isoflurane. This and this keeps her asleep. This gives her a minimum of oxygen that will make her be comfortable during the whole procedure. And we can also note that this bag is moving, which is a confirmation of what we read over here. She's breathing nicely. She's quite stable, doing quite well. So at the end of the surgery, we'll turn this off and this off, and she will be awake in 5 minutes, usually quite awake. And then we bring her into our so-called recovery room, which is very limited but still useful.
Eunice has been found to have a ruptured eardrum and a broken ear bone chain.
Can't say the real cause is, as often with diseases, you can't say why. You can't tell, just tell the round knife. You can't tell that there is a disease, but often we don't know why. This is example of a long-standing problem in the ear. Perhaps because of lack of air, a reduced function of the eustachian tube.
So he's freeing this tympanic membrane to come out and then reconstruct the chain of the hearing bones. It's a chain of bones that goes and will affect the inner ear, which makes the hearing. So when he's freed this one, it will come out like this and be straight again, and might be also needed to put some elastic in here to prevent it to go backwards.
The tympanic membrane of the ear is a three-layer structure. The outer and inner layers consist of epithelium cells. A ruptured eardrum is a tear in the thin membrane that separates your outer ear from your inner ear. Perforations occur as a result of defects in the middle layer, which contains elastic collagen fibers. One of the most common causes of this is an ear infection. An adult with perforation will generally notice a hearing loss in the ear. Water entering the ear when showering or swimming may be painful and can cause dizziness.
This is not very easy to tell, but I'm exploring the middle ear, cleaning from unwanted tissue and repairing the ossicular chain, the ear bone chain. So the main operation is restoring hearing by repairing broken ear bone chain and restoring the air space behind the tympanic membrane. I have splitted the ingrown tympanic membrane from the inner wall, and we will also put a piece of plastic to prevent a new ingrowth into this middle ear wall.
In small perforations, an incision is made into the ear canal and the remaining eardrum is elevated away from the bony ear canal and lifted forward. The operating microscope helps to enlarge the view of the ear structures, giving a more detailed image to the ear surgeon. If the perforation is very large or the hole is far forward and away from the view of the surgeon, it may be necessary to perform an incision behind the ear. This elevates the entire outer ear forward, gaining access to the perforation. Once the hole is exposed fully, the perforated remnant is rotated forward and the bones of hearing are inspected. There may be a scar tissue and burns surrounding the bones of hearing. These can be removed either with micro hooks or laser.
This is the second smallest bone in the body. This is the anvil. And this is, we will replay, we are remodeling it and putting it back again. So it's a very important bone to keep, and it can give the patient normal hearing if put in correct place again.
Is it fully cleaned up? Yeah. Pull it out. Yeah. We'll do the same procedure.
The operation is over. We have switched off our gases, and then the patient should be coming out of the anesthesia in a few minutes from now. So basically we observe the patient and then we extubate them, that is remove the tube that we are using to give the anesthetic gases, and then we give them some time for them to reverse.
Generally, one can return home within 2 to 3 hours after the surgery. Antibiotics are given along with a mild pain reliever. After 10 days, the packing is removed and the ear is evaluated to see if the graft was successful. water is kept away from the ear and nose blowing is highly discouraged. Most patients can return to work after 5 or 6 days or 2 to 3 weeks if they perform heavy physical labor. After 3 weeks, all parking is completely removed under the operating microscope. It is then determined whether or not the graft has fully taken. Eunice is one of the many beneficiaries courtesy of Lion's annual ear surgery camp.
For these exercises, those very desperate cases, we operated free of charge. We intervene and they are not charged. And in fact, most of these operations are free because the patients are not charged any money for the operation. But they only maybe contribute, those who can, they contribute something for the materials used in the hospital. Otherwise, they are free.
So, I'm sure from everything that we've highlighted on the show, you are asking yourself, then, how am I supposed to take good care of my ears? Today is your lucky day. Let's have a look.
Once your hearing is damaged, it's gone for good. Don't wait until it's too late to start taking care of your ears. Here are easy ways to protect your ears and your hearing health. With all the noisy matatus and surrounding, start by using earplugs when in such environment. Clubs, concerts, lawn mowers, chainsaws and any other noises that force you to shout so the person next to you can hear your voice all create dangerous levels of sound. Earplugs are convenient and easy to obtain. According to the World Health Organization, 1.1 billion teenagers and young adults worldwide are at risk for noise-induced hearing loss from unsafe use of audio devices such as MP3 players and mobile phones. If you like to enjoy music through headphones or earphones, you can protect your ears by following the 60-60 rule. This suggestion is to listen with headphones at no more than 60% volume for no more than 60 minutes a day. Earphones are especially dangerous as they fit directly next to the eardrum. If possible, opt for over-the-ear headphones. If you're exposed to loud noises for a prolonged period of time, your ears need time to recover. Researchers have found that ears need an average of 16 hours of quiet to recover from one loud night out. Are you used to cleaning your ears using cotton swabs? Inserting anything inside your ear canals risk damaging sensitive organs like the eardrum. Furthermore, the ears are self-cleansing organs and wax stops dust and other harmful particles from entering the canal. Stressed out? Relax and chill as stress and anxiety have been linked to both temporary and permanent tinnitus, a phantom ringing in the ears. High levels of stress cause the body to go into fight or flight mode, which is an instinctual reaction that fills your body with adrenaline to help you either fight or flee from danger. It's commonly thought that this pressure and stress can travel up into your inner ear and contribute to tinnitus symptoms. Most importantly, remember to go for regular ear screenings at least annually.
And just like that, it's a wrap for me. But I do believe this edition of Family Health was informative and educative to you. But we can keep the conversation going on using the contact information on your screen right now. You can also get to watch all our previous shows which are uploaded on our YouTube page, which is Family Media. Until next week, remember, stay healthy, keep safe. I know it's the festive season, but remember, January is just around the corner. See you.